Let's continue our conversation with Wisconsin Senator Ron Johnson. Ron, thanks very much for staying with us here on America's Forum. And there's been a lot of debate about mandated quarantines for returning doctors and nurses and who should be in charge of those, the federal government or perhaps state governments. Do we need a more consistent message from the president about what should be done?
The first thing we need is competent management out of this president and out of his White House. But I think we do need a national standard. And, JD, this is a difficult situation, but it doesn't have to be that complex. The president's right is we need to incentivize the healthcare workers, these heroes, to go to West Africa and contain the disease there. But, our second goal is we absolutely have to try and keep Ebola out of America. And so I think some common sense procedures, treating those healthcare workers with real respect, with, a good protocol for monitoring would probably be, I think, sufficient. And then I think as well, the way we treat our military personnel, first of all, they should not be in contact, from my standpoint, unless they volunteer. They shouldn't be in contact with Ebola patients, but the military will handle those folks. And then everybody else will be handled differently. We just want to deter people from coming, non-U.S. citizens from coming from West Africa into America, and that you can set up with a quarantine or isolation outside of the country before they'd ever get in here. So there's a common sense way of managing this situation, but we just don't have competent management in the White House.
Ron, you made mention of the military, and we know that over at the Pentagon, Joint Chiefs Chairman Martin Dempsey has recommended to Defense Secretary Hagel that the Pentagon consider a regimented program of 21 days of controlled, supervised monitoring for all troops returning from those Ebola response efforts in West Africa. Ron, it seems that the Pentagon has an idea of what to do, and yet the administration is reticent to go forward with a plan, or they're letting. Is this another example of our commander-in-chief leading from behind?
Well, it's an example of our commander-in-chief not knowing how to command, not knowing how to lead, knowing how to manage. Military leaders have got real experience in leading. They've done it all their lives, their entire careers. President Obama came into the White House never having led anything, never having managed anything, and unfortunately, we're all paying the price for his lack of qualification when it comes to management.
Ron, a colleague of yours, in fact, the Republican leader in the Senate, Mitch McConnell, said yesterday he now supports a travel ban, saying that to him now it makes a lot of sense. Your thought on Mitch's pronouncement there?
Well, again, I don't use the word ban because we need to have healthcare workers going back and forth. We need our military crews to go and construct these isolation units. So I always keep talking about some pretty significant travel restrictions that just make common sense. You'd rather be safe rather than sorry. So I just look at some very significant travel restrictions is the term I use.
Let's change to another hot button topic, and that is Obamacare. We know you've gone to court over it. The Washington Times features an article today saying that health care premiums under Obamacare are skyrocketing by as much as 78%. Your thoughts on that, please, sir?
Yeah, as I'm traveling around Wisconsin, I'm talking to businesses and I'm talking to healthcare providers and insurance agents as well, and they're seeing that same kind of range, anywhere from 16 to 60%, kind of with an average around 30% here, just anecdotally in Wisconsin. Now, JD, we're like that proverbial frog in the water right now when it comes to our healthcare system. Obamacare is going to be very corrosive, very destructive to our healthcare system. People aren't going to realize it right away, but they're starting to wake up and understand it. And the problem is our news media really isn't covering all the damage that's being done. For example, doctors that are just fed up with the system, retiring, paying their children who've always wanted to be doctors bonuses not to go into medicine because they think it's going to be such a miserable field. So we may have guaranteed more access to people, or more coverage, but that doesn't guarantee medical access and quality.
Well, let's get some access to your thoughts politically there at home in Wisconsin. That really tight governor race between Scott Walker, your fellow Republican, and his Democrat challenger, Mary Burke. We're hearing it's in a dead heat. 30 seconds remain. You have the last word to tell us what's going on the ground there.
Well, it's too close for comfort, but listen, Scott Walker's done a great job putting Wisconsin on the right path. And Mary Burke, more and more you learn about her, she really is an empty suit. There's a new story out today in terms of how unsuccessful she actually was in managing her portion of Trek Bicycle. This has been her number one qualification. So I think Wisconsinites are going to hopefully get informed, and I think the choice
And
is quite
you've
clear
done
to
a
reelect
good
Scott
bit
Walker.
informing us. Ron Johnson, Senator of Wisconsin, thanks for your time.